And of course, depression has a huge impact on child's well-being, right? And it can affect all areas of life. It can affect school, it can affect friendships, it can lead to risky behaviors or going towards like chronic substance use. And unfortunately, some of those unhealthy coping strategies can then create more problems and feed the depression further. How does depression in children show up differently than in adults? And what do we know about depression in kids? I'm Dr. Lewis. I'm a psychiatrist. I'm a child and adolescent psychiatrist and also an integrative psychiatrist. And I work with kids, adolescents, and adults. So when we think of depression, we often think about adults, but kids and adolescents also experience depression, and it may manifest differently, so it might be a little more difficult to pick up, and it's important to pick it up. So unfortunately, children and adolescents are experiencing depression at higher rates than in the past. And parents, clinicians, may not pick it up. So let's talk about like what is it so that we can get better at it. What causes depression? We don't know exactly, right? Like there's lots of research and we have lots of likely explanations, but we don't have like the perfect clear explanation. There may also be many different types of depression caused by different things, such as like inflammatory depression is one example. There's definitely a genetic component. So if someone in the family had depression, there's an increased risk for other people in the family to have depression. There may also be all kinds of environmental factors that increase the risk for depression, right? So that could be how school is working, lifestyle factors, early childhood exposures, all kinds of things like that. Also, how well the brain is working, neurotransmitters, right? How well nourished the child is so that the brain can be working well. What's the inflammation level, right? So all of these different factors and like 25 more interact, and it may not be possible to like pinpoint like a single cause for a particular person's depression. Sometimes it is, right? When there's like a clear trauma or crisis or physical illness or something like that, and then someone develops depression, okay, it's pretty clear, right? They probably still had a predisposition. But most of the time, we know there are many causes. We may not be able to like call the one actual cause, and it's still important to figure out what to do next, right? It's also important to understand like what are the risk factors, right? Same two people might be in like the same circumstances, and one will develop depression, one will not, right? So let's understand maybe also how we can make our children more resilient and less likely to become depressed. And the kids who do have risk factors, they need extra support in learning how to be resilient, right? To lower the risk for developing depression. So some of the key risk factors are history of depression in a parent or a sibling, right? So it's kind of like thinking of like how many hits, right? How many risk factors someone has, right? And maybe it's just 5, they won't get depressed, but if it's 10, right, they can tip into actually having depression, right? So genetics, family problems, right? Conflict with caregiver, huge risk factor for childhood, adolescent depression. Exposure to adversity early in life, right? That could be abuse, neglect, loss of a significant person in life, parents' divorce, a big move, something like a big illness, right? Something like that. It could be problems with friends, right? Or school, or a mismatch between the child and the school. So that's a risk factor. It could be issues around sexuality and gender identity. So for sure there are higher rates of depression and mental health issues in queer kids and with gender concerns. Other things, negative outlook or lack of coping skills, right? Just not having good skills for dealing with like the daily stresses and annoyances of life, being more stress sensitive. Also prior depression, right? So much more likely to get depressed again. Also history of other mental health conditions or having another one, like so anxiety, ADHD, conduct issues, right? Other mental health issues make it more likely to then get also depression. Also like early childhood stuff, so either being born prematurely, low birth weight, or brain injury, that increases risk. And medical illness, right? So that could be like pain or actually something being off, right? So those are some factors, right? Of course there are more, right? You could add sleep deprivation, you could add like poor diet, lack of exercise, very stressful schools, right? Like there are many, many, many additional things that could be on this list, right? So the other thing to think about is that the diagnostic criteria, right? Like how we diagnose depression in adults, and it may look different in kids and adolescents, right? So we just need to pay attention to picking up symptoms that might look different in children than in adults. And to officially get diagnosed with depression, we use the DSM-5 criteria, and a child needs to have at least 5 or more of the following key symptoms, right? And that should be most of the day for at least 2 weeks, right? So that's to get the full diagnosis. If someone doesn't meet, they only have 4, that's still significant, right? That's like 4 symptoms of depression, right? Doesn't meet the full criteria, but it should be addressed, right? And at least one of the symptoms must be either depressed mood or this like anhedonia, this loss of interest or pleasure, right? So if someone has fewer than 5 symptoms, but is not functioning in some key area of life, like can't go to school, apply the same treatment, right? Still treat, still help that child. So the key symptom, depressed mood, right? So that could be feeling down, sad, like blue most of the time, right? This is the key symptom. And that can be, like also feeling like other people don't care, like kind of broody and moody and gloomy and hopeless, and kind of, kids often say this, like it's unfair, the sibling got this and right, I didn't, or my older sibling gets to stay up. Also helplessness, right? And worry that they are a disappointment, and all kinds of other negative judgmental thoughts about themselves. And children and adolescents sometimes like don't have the like maturity to really describe what they're feeling, or to know that they're dealing with depression, or even to label these emotions, right? And instead of sad, what you may see is irritable, right? So instead of like sad and low, you may see cranky, annoyed, bothered, like by everything and everyone, including their parents, right? And that's just a different way of expressing sadness, right? So if your kid is really grouchy, do have a suspicion, like this could be depression, right? Or if the kid is like picking fights and getting to arguments, that might be like a way to like induce the emotion they're feeling in other people, communicate like that, right? Or just show their emotional distress, right? So as like people around, like we need to like pay attention to how kids may express depression differently, right? It could also be like lots of anger, right? That could be the only emotion that is shown, even though it's really depression, right? And as like a coping mechanism, teens and adolescents often seek something to like feel better and lift their mood, and that might be all kinds of behaviors that make everybody very nervous, right? That might be risk-taking, thrill-seeking, drug use, unsafe sex, all kinds of things like that, just to get like a dopamine hit, right? It could be also getting stuck on a screen, right? And just trying to escape into something, numbing, right? Numbing with watching a series or reading fan fiction or something like that. So because depressed adolescents, especially girls, want to commiserate with others about how they're feeling, that may actually create these whole like groups and pools of kids, this kind of these little epidemics that may happen at a school, in a particular peer group. So that's also something to watch, right? If a bunch of kids are all depressed, right? Like how to help the whole group. Another key feature is this loss of interest and pleasure, right? So if a kid enjoyed something and then suddenly is like not interested, that's, the official term is anhedonia. That's like a very concerning warning sign, right? So if they used to love makeup and now they just don't do anything, it's like, what's going on, right? Or if they are more withdrawn, or if they say everything is boring or stupid or uninteresting, which the boring thing is a big thing with kids. I need to make a different video about that. Or they withdraw, right? They stop pursuing their interest in art or music, or withdraw from friends they used to love, right? That might be a warning, right? Another thing to watch for is changes in weight, right? So this is like in adults, a common thing, but in kids, that could be, either an increase or decrease in weight, the appetite change, right? Or not gaining weight as expected, right? Kids are supposed to be gaining weight. So if the child was on a growth curve and suddenly they fall off the growth curve, maybe they didn't lose weight, but they didn't gain as much as they were supposed to. That's potentially because of depression. Sleep disturbance, right? So kids with depression could sleep too little, or they could sleep too much, or they could sleep in a very disorganized, weird pattern, right? So it might be like trouble going to sleep, then like getting up at night, then can't go back to sleep, or sleeping in the day and not at night, right? Or that's a very concerning one, because that one gets in the way of school. So big sleep disturbances are definitely something to watch for, and that could be a symptom of depression, right? And if the child is chronically in this like not getting enough sleep, then a lot of things can get worse very quickly. So it's a very important symptom to address. Another symptom is being physically like slow down and heavy, just like, I can't even get up, or agitated, right? So like restless, agitated, can't sit still, right? So that can also be, those are both, two poles of the same symptom. And the agitation, right? This kind of restlessness, that could be pacing and fidgeting, pulling hair, like doing something, right? Or it could be like the slowing, right? Could be slowing of everything, slowing of movement, but also slowing of thinking, slowing of speech. So if you see like some big change, that's a warning sign. Fatigue, right? Or very low energy, right? If the kid used to have a lot of energy and now they have little energy, that could be a symptom of depression. So a change in energy level, feeling like exhausted. And, kids might need to rest, right? That's like different, right? It's like also distinguishing like what's just normal fatigue and what's unusual, right? So your child, right? You can watch your child. Is it a big change? Or is it it's just within like a range, right? Of like what happens with energy levels. Another symptom of depression is feelings of worthlessness or guilt. But depressed children may not like name it that way, but they may feel like a failure or worthless or inadequate. And this symptom can be a little bit tough to assess. So just listen for certain things, right? These feelings of worthlessness or guilt may be like being very critical about oneself, or like dismissive or critical about their accomplishments. It could also be like having trouble naming anything good about oneself, right? Or dismissing anything positive, or being really dissatisfied with like multiple aspects of themselves. Another thing that could happen here is lying, right? So lying about success or skills to kind of bolster self-esteem, which, you know, then can get kids into all kinds of trouble too. Or be really like preoccupied with other people, like envy, or like preoccupied with other people's success, or how people look on social media, or other people's grades. And they may also take on excessive blame, right? So blame themselves even for things that are not possibly like their fault, right? So this, you know, like the opposite of, it's not good like taking responsibility, it's excessive, right? And they may also think that they've been bad, they deserve to be punished, that they should be punished for things that are not their fault, but it's somehow their fault. So it's just watching for things like that. They may also be unwilling to even like try anything or do anything because they're convinced they will fail. So another symptom is impaired concentration and trouble with making decisions. And depressed kids and adolescents can have trouble with attention, concentration, memory, that were not there before, right? That this is not a kid who had lifelong ADHD. This is a child who was fine with attention and suddenly can't focus, can't read a book, can't finish a worksheet. They may also have trouble like processing information, be like slower with processing information or like doing schoolwork, or may be paralyzed with decisions, like cannot decide what to have for dinner, or where to go, or which friend to call, things like that. Things may take longer, right? So homework suddenly takes many hours, and things like that. Another symptom is recurring thoughts of either death or thoughts about suicide. So this is a very concerning symptom, and kids with depression can have recurrent thoughts about death, fear of death. They can have thoughts about suicide. They may also attempt suicide. There's definitely an increase in suicide in children and teens. So this is a morbid theme. This is hard to think about, and it's important to figure out if it's there. There could be passive suicidal ideation, which is just these like thoughts, oh, I'd rather not wake up, life is not worth living, other people would be better off if I were dead. And some teenagers have active suicidal ideations, which means they actually think about doing something to hurt themselves, to kill themselves, or making plans, right? Or making some kind of like pact, or even attempting, right? And those who consider suicide often do it because of this incredibly difficult sense of hopelessness, and they just don't see any other options or any other way to escape the pain they're in, right? So it's very important to think about preventing suicide. Suicide is like the worst thing that could happen. It's tragic and it's potentially preventable, right? It's a symptom of depression, of severe depression. And please watch my video about how to lower and prevent suicide in young adults and adolescents. So any mention of suicide, self-harm, any signs of suicide, thinking, planning, you got to take it really seriously. Right? So if it's ideation, that's the talking, thinking about, looking for ways, that needs treatment, with a therapist. If it's more than that, you may need to like immediately reach out for help. Call 911 or go to an emergency room, see a clinician. Another symptom of depression is substance abuse, right? So increased substance abuse. Other symptoms are kind of feeling like more anxious, agitated, or sleep pattern changes that came out of nowhere. This is not something that was typical for the child. Also thoughts about being like a burden, right? So like if you hear that from a child, that's a sign of depression. Another sign of depression is withdrawal, right? So withdrawing from family, from friends, from school, right? Those are signs of depression. There could be other things, anger, recklessness, right? Like, so kids present in a variety of different ways that may not be the standard symptoms of depression. And parents who are concerned, like if you're concerned about someone in your life, a young person, it's very important to get help, to clarify how acute the risk is. Like, can you wait for an appointment for 3 weeks? Do you need to go see someone right away? And if there's any risk of like suicide, for sure, like act immediately to get help. Like if you feel like, you know, you can take time, see your pediatrician, make an appointment with a child psychiatrist or a therapist, someone appropriate. So if a child is depressed and it's really acute, or there's suicidality, child potentially may need to be hospitalized, right? So that's like in extreme situations of high risk. Most kids with depression can go into outpatient treatment, and that's therapy, you know, over time, lifestyle changes, addressing whatever issues in life are affecting the child, more monitoring, planning, potentially medications, potentially natural treatments. You know, it could be many different options for treatment. That's like a whole different topic. And of course, depression has a huge impact on child's well-being, right? And it can affect all areas of life. It can affect school, it can affect friendships, it can lead to risky behaviors or going towards like chronic substance use. And unfortunately, some of those unhealthy coping strategies can then create more problems and feed the depression further. Another thing to consider is comorbidity. So comorbidity is when someone has 2 or more medical conditions, right? And in the case of pediatric depression, it's very typical. Most kids who have depression will also have some other psychiatric disorder, and many may have multiple psychiatric disorders, right? So, you know, it's somewhere around like 70% of kids with depression will have something else. Most common anxiety disorder or attention deficit, oppositional defiant disorder, substance use disorders. It could be many other things, right? Or it could be multiple things on this list. And depression can also increase the risk of other disorders like getting worse and setting in. It could increase the risk for eating disorders, for substance abuse. So having any of these additional conditions can make it more difficult to figure out what's going on and to treat. And it is important to treat all of the conditions, right? To have a comprehensive treatment plan that addresses all the needs the child may have. There are also potentially like medical risks associated with depression in adolescents. There's an increased risk for cardiovascular issues and issues that go with that, for obesity, for diabetes, for smoking. So kids who are getting treated for depression should also be assessed for their like medical well-being, and also all those medical issues, if they increase inflammation, right, they can contribute to depression, right? Depression is doubled in people who have diabetes or blood sugar issues. So how to figure out how to get an official diagnosis? You will need to take your child to a healthcare provider, and that could be a pediatrician, it could be a psychiatrist, it could be a psychologist, and they need a comprehensive evaluation. You should be involved to provide information. Clinician will see your child. Sometimes there might be some blood work to rule out, any medical issues contributing. And depending on your child's age and what's going on, it might be a good idea to have the child speak to the clinician on their own for part of the time. When I see kids, under about 14, 15, I do want to see the parent first. If they're 14 up, I'll ask the mom and the dad and the kid who would like to go first. And sometimes the kids want to give their story first. They're owning the experience, right? So that, and sometimes everybody's all together all the time. So that's individual, depends on whatever works for each family. And different clinicians have different approaches, different style with who they speak to first and how to organize the evaluation. And after an evaluation, hopefully you'll be presented with options for treatment. And luckily there are treatment options, so it's also important to stay hopeful. And you might be presented with there's option for therapy, medications. You should consider these lifestyle modifications. There are these alternative therapies available. Alternative therapies, only some clinicians will present any options for that. Then you can start to figure out what's the plan. And usually anticipate that the treatment will be, a year, 2 years. And even after recovery, a good chunk, around half of the children will relapse, will have another episode of depression, right? So in adolescents, depression may, initial bout may last, 6 months, 9 months. And then again, a good chunk will relapse and have another episode of depression at some other point in the future. There are also different subtypes of depression. We're just figuring out what are all the different subtypes. For sure, there's this anxious depression, right? There's a lot of worrying and pacing and it just looks like there's also anxiety there. There are other situations that are more specific, women or girls can have terrible symptoms of depression, potentially for 2 weeks, before their menstrual cycle, right? So that's premenstrual dysphoric disorder. This could be also related to pregnancy, childbirth, postpartum, right? That could be a flavor of depression, different manifestations. There could be seasonal, right? That comes for most people with winter and dark, but for some people with summertime. So, so there are many other subtypes potentially, definitely inflammatory depression. A few other types also. Okay, and you may be asking, as a parent, when is the right time to look for help? What is normal adolescence, normal issues, and when are things serious enough that you need help, right? That you need to get an evaluation, that you need to see someone. And we discussed the symptoms, so hopefully you'll have some sense of if a lot of those symptoms are there, definitely seek help, right? If there's any suicidality, immediately seek help, right? Take it very seriously. And if things are mostly okay, but you're concerned or something is off, right? Then try to figure it out with a clinician or with a pediatrician, at least at the beginning, if more investigation and further assessment is needed. I hope this was helpful and not too overwhelming. I hope this empowers you. Let's all work together to improve child mental health. This is an area that needs so much attention, so much research and growth. And let's take care of kids better, and let's recognize childhood mental health issues better, and let's also work towards creating a world where childhood depression is less likely, right? Addressing the systems level, the societal pressures on children that might be affecting them. Thank you for watching. See you next time.